Hello and welcome to the first episode of the Cripped podcast. Now, before we dive into it, you might be wondering, what on earth is the Cripped podcast? Well, this started as a personal journey of myself as a response to a permanent partial disability that I received from a workplace injury. Long story short, I completely dislocated my knee. I fully ruptured my ACL, MCL, PCL, tore my meniscus, tore my quad, and I fractured my femur just to top things off. Now, personally, I was left with a choice. Now, unfortunately, I see a lot of people in this type of situation give up to their circumstances and live a very unfulfilling life. And that is not something that I want to see for anybody. So I want to encourage those around me through influence and inspiration and show that even when life throws you a curveball with a life-altering injury or a very long-term recovery, that it is not the end. And that is where the birth of the Cripped podcast came from. Throughout this series, I will be bringing on exceptional individuals who have gone through their own long-term recoveries, often life-altering injuries, and sometimes leading to full permanent disabilities. For today's episode, I am joined by Cynthia Colten, who is a local physiotherapist right here in Cranbrook, and she is one who I worked with personally throughout my recovery. We're going to explore a little bit of more in-depth about my own injury, as well as some overall general advice for others going through this situation. I think it turned out as an incredible episode, and I hope you all enjoy it. Without further ado, let's get to it.
Welcome to the Cripped podcast, where we explore serious and often life-altering injuries, long-term recoveries, and the inspirational people who refuse to give up. Starring Cranbrook local, your host, Darcy Allen.
Cynthia, welcome to the show.
Thanks, Darcy.
So why don't you tell us a little bit about yourself?
Okay. So I've been a physiotherapist now for 32 years. I graduated in 1993 from the University of Manitoba. And I initially got into physiotherapy because then I had a basketball injury. I tore my left ACL and my medial meniscus. So post-rehab back then, it was way different than now. You had the plaster cast on for 6 weeks afterwards, and your leg comes out of the cast and it's like this big. So lots of rehab afterwards. And then after that, I just kind of got into the profession, and I've loved it so far. Yeah, it's been great.
So you said you did a lot of sports in the past. Is anything specific, or did you kind of dip your toes into a lot of different things?
Yeah, I've done a little bit of everything. I have competed in bodybuilding 3 times, and then I got into doing triathlons, and now I do a half Ironman every year, just one. So road cycling, do some mountain biking, fat biking, and running, trail running, play a bit of golf, just kind of a little bit of everything. Enjoy just being outside. Cranbrook's like the best place for that. Lots of hiking, and we're so fortunate here.
It really is. I mean, if you enjoy the outdoors, I mean, it's right in our backyard here. So
yeah, it's perfect.
So what got you into physiotherapy in the first place? Was that just something you went through college and decided to get into, or was there something that sparked that passion?
Yeah, so more the injury that I had and just going through the rehab. Because it was, I just had the ACL tear and partial medial meniscus tear. So I did have the surgery done, and just rehabbing through it, it just kind of really got me interested in the profession. I always knew I wanted to do something in the medical field. So it just fit. It just fit for me and for my lifestyle.
What would you say the main thing was that was like, okay, this is what I want to do with my life?
Well, I mean, it probably sounds cliche, but just helping others for one. And a lot of over the past few years, just with being a physio for so long, just hearing people being so gracious that they have improved, and a few times I hear, thank you so much for giving my life back, just things like that really hit home. And I've just been, I mean, that doesn't happen all the time. I wish it did. I wish there was a magic wand a lot of times too. But it's yeah, it's been great. It's just that feel good feeling when people get better and you can see it in their face and see it in their lifestyle and they're back doing what they want to do. It's huge for sure.
What would you say is probably one of the most drastic changes you've seen, from a very serious injury to, a really long recovery to get back to, a functional lifestyle? What's the biggest change that you've seen in that?
Well, I think that's a tough question to answer just because the injuries that we see at our clinic, like it's Cranbrook, so you see everything and anything. I would say post-spinal surgeries, though, even post-major knee, like joint surgeries like you had, joint replacements, shoulder replacements, the knees and hips I find come along a little bit faster now just with technology. But yeah, and a lot of times too, it's those multiple joint injuries too, like say people recovering from car accidents
Hmm.
where it's not just their shoulder, it's their shoulder, it's their neck, it's their hip, it's their knee, right? When they're in those really bad MBAs.
Right.
Yeah, so that can be very challenging. Yeah, because you're dealing with a multitude of injuries rather than just one.
I can imagine that being a lot more difficult. I mean,
Yeah.
mine was pretty localized to one area of my body, but when it's affecting, your legs, your shoulders, your arms, your spine,
Yeah.
that's a whole different level.
Yeah, it's a whole different level. Yeah. People need a lot more help, like a
Yeah.
more of a village approach for sure. Yeah.
Yeah, because I mean, when you get into that, I mean, you're not just losing, not just losing the function of a leg, but you're also losing the function of your arms and this and that, and
Mhm.
just doing basic things like going to the bathroom or having a
Mhm.
shower or a bath is tremendously much more difficult.
Mhm. Yeah, it can be a challenge for sure.
So, being in the Cranbrook area,
Mhm.
what would you say is probably the most common injury that you see, maybe not on a day-to-day basis, but, throughout the year?
I would say shoulder injuries and back injuries. Those are probably the most common. And usually, I think from just working here, there's a lot of people that work in the mines and
Hmm.
a lot of manual labor. So people just have a lot of overuse kind of injuries. So
Right.
that's really common with shoulders. We see a lot of that.
So a lot of repetitive stress
A lot of
syndrome and
repetitive stress injuries. And then, of course, with the backs, it's the bending, it's the lifting. It's just not that one time, it's the repetition. And they say to me, yeah, I bent over and picked up this box that I've done
yeah.
100 times. And then their disc goes or, whatever is injured at that time. But it's not from that particular injury, it's a buildup. So we see a lot of that kind of thing as well.
So it's a little more
Yeah,
like chiseling away slowly. It's not usually that
right,
one specific event that's causing a lot of the more common injuries.
right.
It's that slow.
Yeah, it's like happens over years. A lot of people will
Right.
come in and then 3 years later, they're like, "Okay, now I can't move my arm." So
Right. It's kind
I
of like
should have been in 2 years ago.
it's kind of like the expression, the final straw on the camel's back, or,
Yeah,
or however that's said.
yeah,
It's just finally the body's like, okay, that's enough.
yeah,
we need to fix this now.
yeah, that's exactly it. Yeah.
Is there anything that comes to mind as like, this is the absolute worst injury that I've seen, like, or an experience where you possibly might have struggled to figure out a way to properly help a person due to the severity of an injury? Has there ever been anything like that?
Yeah, I think there's always been a struggle with certain people with like the multiple injuries, and it's mainly from yeah, more motor vehicle or just a severe fall, say off the back of a truck or any even something like you had,
Yeah.
but more with when people have more multiple injuries. Yeah, sometimes they'll never be the same.
Yeah.
And you can get them to a certain point, but then it's kind of it is what it is for some patients. And some of those patients even still come and see me once a month.
Right.
They maybe aren't doing everything. They maybe have had to change jobs, they've had to change their recreational activities, but they still want to function the best that they can. So there's still help for even chronic types of injuries like that.
Right.
And if people are motivated and want to really help themselves, I always think there's always help out there somehow for people. Yeah, I don't know if that answers the question properly, but
No, that's great.
okay.
So when it comes to these big, serious injuries, how much do you believe that the mental side plays a role into the recovery process?
Yeah. So that's huge. I find that people recover faster and more effectively if they have been active pre-injury.
Right.
So if they've always had fitness as part of their lifestyle and they're keen to get back to what they were doing before, it's huge. It is harder sometimes to rehab patients that have been sedentary for a prolonged period of time or fitness has never been an
Hmm.
aspect of their life. Um, there's people out there that are like that, and
Yeah.
there's nothing wrong with that. But if they do have an injury, I find sometimes it is harder for them to recover because
Right.
they have less body awareness and less body synergy, I guess you can call it.
Yeah.
So I find it is harder to treat patients like that.
I
Yeah,
can absolutely understand that. I mean,
yeah,
I was a strongman athlete before my injury.
yeah.
So I did a lot of strength training, a lot of squats, a lot of deadlifts, a lot of, upper body stuff.
Hmm.
And, I'll always advocate for, strength training in general, just as a
Hmm.
overall prevention of an injury or a more severe injury,
Yeah.
just for what it does to strengthen the bone density, the muscle
Hmm.
around the bones.
Hmm.
It's one of those things you almost kind of want to do it before it's too late,
Hmm.
so to speak.
Exactly. Yeah. Yeah.
So with that being said, when I came across your desk for the first time with my injury,
Yeah.
I completely dislocated my knee. I
Yeah.
fully ruptured my ACL, my MCL, my PCL. I tore my meniscus. I tore my quad, and I fractured my femur,
Yeah.
all from a single injury. What was your kind of initial thoughts or reaction? When you when you saw that for the first time?
So initially, when you came in and you just had the MCL repaired, and then you were waiting to have the rest
Yeah,
repaired, whatever, if I think it was 5 months later, six
yeah,
months
yeah.
later,
About 6 months.
I knew it was going to be a long haul for you. I'll be honest. Like in my mind, I just went, oh man, this is going to be a long recovery. But once we worked together for a bit, and I think you were dedicated to your recovery, and I knew you had that background too
Yeah.
of pushing yourself and working hard and having that mentality. I think that really helped with your recovery. But yeah, in all honesty, when I read through the report and got the OR reports, I was like, yeah, okay, this is gonna be a long one, but he can do it. We can get through this. And I was also happy that you had a really good surgeon
Yeah.
because I really trusted, just from patients I'd seen in the past that had seen him, I knew you were in really good hands there. So I think that made me feel good inside as well, that you were in good hands surgically.
Yeah, and I with the surgeon, I did feel pretty comfortable around him. He was very
Hmm.
straightforward.
Hmm.
He didn't beat around the bush or anything like that. I mean,
Yeah.
I remember initially, I asked him, I said, on a scale of 1 to 10, how bad is this?
Yeah.
And without hesitation, he very quickly said 9.
Yeah.
It's an 8.5, 9.
Yeah.
A 10 would have been losing the leg,
Yeah.
because that was another big concern as well. As I was very high risk initially of having to amputate my leg. They had to keep me overnight in the hospital that first night, which was in Cranbrook here.
Yeah.
So this is before they sent me down to Kelowna. And, every hour they were having to come in and, as soon as I'd start to doze off, which is really hard to do in the emergency room area,
No
because there's,
kidding.
especially late at night,
Yeah.
there is all sorts of noises. And
Yeah.
anybody that's been through in the emergency, overnight especially, can probably attest to
Attest
that.
to that. Yeah.
But yeah, every hour they were coming in, just checking the blood pressure, making sure that
Right.
things were flowing. Because if
Right.
certain nerves or whatever were pinched, then
Hmm.
yeah, I mean, it was the way it was described to me was I essentially amputated my leg on the inside,
Hmm.
and all that was left was basically the skin and a little bit of muscle surrounding the joint that was kind of holding it together. So
Yeah.
any worse, and I don't know if I would have a leg today.
Hmm.
You
Yeah, you're
know,
lucky you didn't rupture an artery or something like that. Like I
yeah,
remember reading through the report, and once you had all your tests done, like none of that showed up. So thank goodness for that.
I think I was very lucky to have only fractured my femur.
Yeah.
And again, that's where the strength training comes in. I 1000% believe that had it not been for all the time that I spent in the gym, I very well potentially could have shattered the leg. And had that happened, we would have been having probably a completely different conversation right now.
Yeah, exactly. Yeah.
So going back to, my injury,
hmm
and for anyone else that has something similar, in those early stages, going into a little bit of the later stages, what are some of the main kind of exercises that you would have, like myself or someone else kind of go through? What are the main things that you would be focusing on?
So I think for post-surgical, obviously we would follow the protocol that the surgeon provided for us. Usually, sometimes there can be restrictions with range of motion, like there was with you for the first 6 weeks, and then non-weight bearing. When people are non-weight bearing, obviously get them to do exercises on the bed to try to prevent muscle atrophy. Because muscle atrophy happens in days and weeks, not months, right?
Yes.
As you can attest to.
Yeah, my calves shrunk down to almost nothing.
Yeah.
It was like raisins.
Like people, it's unbelievable. But I think as far as like injuries go for people, the sooner they address them and get in for physio, the better.
Yeah.
Like my first thing would be just get in, get some advice, even if it's not, physio once a week or twice a week initially. Get your homework, get some good advice that can help early on with your recovery, whether it's even pre-surgical or if it's post-surgical and you're still non-weight bearing. So the earlier you come in after these injuries, the better. Yeah, people just recover way faster. Yeah.
Yeah, and that's, one thing I wish I would have known was the wait time to get into physiotherapy initially.
Yeah.
Because when I got the green light from, the surgeon, I called around to, all the physiotherapist places in Cranbrook here. And, essentially I went to you because that was the first available. And I think even that was still about 6 weeks out. So
it was, like September 5th or something, right?
yeah,
Or
so
around there.
it's kind of like one of those things that's, if you know that beforehand, then you'd be starting to get the ball rolling on it sooner rather than later, because like you said,
right. Yeah.
the sooner you start working on, the proper rehab and the physiotherapy, the quicker you're going to start progressing, right?
Yeah, that's right. Yeah. And I think the surgeons sometimes forget that too, right? Like post-surgery, they're so concerned about what they're doing.
Yeah.
And they forget to say, oh yeah, you better get in a physio appointment, for 2 weeks post or whatever.
Yeah.
But I just find that does happen sometimes. They just forget, right? Because their job is kind of done. Yeah, and that happens.
Which, I mean, I guess you can understand. I mean,
For sure. Yeah.
As a patient, you have to remember that you're not the only patient.
Yeah.
Especially specialists like that. They're seeing, I don't know how many people per day, per week, per month, per year.
Yeah.
You're one person in the grand scheme of things. So,
Yeah.
it's good to have that information beforehand. And unfortunately, a lot of people just don't know that. And, hopefully, something like this can bring a little bit more awareness to that.
Exactly. Yeah.
But when it's dealing with the mental health struggles of everything, do you see a lot of changes in people, in their mental fortitude, their, mental toughness per se? How do you see that change and develop over time?
Okay. I think the longer that people are in their recovery, the harder it is. And especially if they do have two different surgeries like yourself. Some people even have more of a multitude of surgeries for some kind of injuries.
Yeah.
And that's, it's really tough. Some people have a really tight social circle, which is great. A lot of family support and friend support that understand what they're going through. But unfortunately, some people don't.
Yeah.
So, I always refer people for counseling, when that's the case, whether they take my advice or not, sometimes a suspect.
Yeah.
But I think that's one, it's definitely such a huge factor to recover from physical injuries, that mental toughness. Yeah, and just to try to push through and just to try to like take the advice of someone that is just sitting there, okay. Do you know
Yeah.
what I mean? Like that's tough
Yeah,
because
like
they're like, well, you're fine.
yeah, like the
Thanks a lot.
little stubbornness starts to kick in, or
Yeah.
whatever it might be, envy maybe.
Yeah.
Like I know for myself, the mental health side of the recovery was, very non-linear.
Yeah.
It had its ebbs and flows. It went
Yeah.
up and down, probably a lot more times than I've even admitted to myself.
Yeah.
When it first happened, because I didn't know the full extent of it yet. It was kind of like, okay, well, I'll recover, I'll get better, and I'll go back to competing in strongman. Because at that time I was set to go to provincials. I earned my spot. I
Yeah, I
worked really
remember
hard for
that.
it.
Yeah.
And, I was just like, hey, well, maybe I'll miss it this year, but I'll get to it next year. And that was kind of the thought process when the injury happened.
Yeah.
And then, it's like reality starts to set in.
Yeah.
And it's like, okay, this is actually a lot more serious than I initially thought. One surgery turns into two surgeries, and, suddenly, 20 months on essentially of recovery, under compensation and things like that.
Yeah.
And, when it's such a long time, that's where I think it becomes a little bit more of a struggle.
Yeah.
Because all you have is time. And, like myself, I live alone other than the times that I have with my daughter.
Yeah.
And, that was another part of it too, was, I lost a lot of time doing activities, with my daughter. She was 6 at the time when the injury happened, just turned 6.
Yeah.
She was just at that age where she was starting to learn to ride a bicycle and things like that. And,
Yeah.
as a dad, that's kind of one of your prides and joys is, teaching your kids how to ride a bike. And, I kind of had that taken away from me. I didn't get that opportunity. She could ride a bike now, but I wasn't the one that got to teach her. And that can be that was tough. It wasn't, I won't beat around the bush on that. That was tough to kind of deal with and manage. And living alone, you get really trapped in your head. So, for me, what helped was, once we transitioned into doing physio, more consistently, because I think we started like once a week, or maybe it was twice a week or something like that.
Yeah.
And then, eventually we started doing, 2-3 times a week, and then throwing in
the program.
throw it in like the hydrotherapy as well, which
Right.
I actually really liked the hydrotherapy.
Okay.
For me, it was a lot of hesitation at first.
I know you were on the fence about it, and I was like, "Oh, Darcy, just do it. Just try it."
Well, because at the time I was still getting around on crutches.
Yeah.
And I'm just like, well, okay, how do I get from the locker room
Yeah.
to the pool
Yeah.
to in the water?
Yeah.
And it took a lot of working, but once I was in the water, suddenly it's like, okay, now all that weight has essentially been taken off of my knee, and I can actually move around and feel weightless, so to speak. And once I got in there, I started, just kind of charging into it. I was doing laps back and forth from the pool, and like really kind of pushing, because I didn't have a lot of opportunity to get my heart rate up. And that was kind of the one place I could at the time. But when it comes to the hydrotherapy in general, I mean, what are your thoughts on that? Is it something you recommend often? Is there anything specific that you recommend over something else, or?
Yeah, no, the hydrotherapy is great. The only contraindication really, if there's a really unstable joint, we don't refer to hydro until that is fixed.
Right.
But as far as any kind of, especially post-spinal surgeries, knees, hips, shoulders, anything like that. Like sometimes it is difficult to convince people to give it a go, especially if they don't like water and if they don't swim. But when we have the kinesiologist there working with them in the pool, and there's always ways to keep them safe, whether it's a noodle or keep them in shallower water, whatever works, we can work with them. And most people love it. Like, I don't think I've ever had somebody come back after a couple times and then, I'm not going back, right? Like, I've actually never had that, which is great.
See, I was actually a little sad when it ended.
Yeah, I believe it. Yeah, for sure. But yeah, it is very beneficial for most injuries, I would say, for
Yeah.
sure. Yeah, especially when they have the right direction too, right? When you can work with
Yeah.
a kinesiologist, I think that's great.
Yeah, I'd imagine if it was just like, oh, go jump in a pool,
Yeah,
very
do
different.
some
But when you're
exercises, yeah.
getting some direction of like, okay, well, like do this to, push down on the noodles to kind of help with your shoulders, or
Mm-hmm.
use a board as resistance, and kind of do some laps back and forth.
Yeah.
It does make a difference. Whereas, if I just been by myself and got told to go to the
Mm-hmm.
pool, I probably would have just waited in there and
Yeah.
not really accomplished a lot.
Mm-hmm.
Which is, why there are professionals like
Mm-hmm.
yourself and
Mm-hmm.
the others that were that I did work with.
Yeah. Yeah. Yeah, that was great.
So in general, when we were working together, was there any like big turning points that you saw in my recovery that was like, okay, he's going to be okay?
Well, I think when we felt like you were ready to do the work conditioning program,
Yeah.
that was huge for me, because I was like, okay, I feel like you were done with me. Like I've done everything that I could for you. And it was the next step to
Yeah.
transition. Like I knew you were already going to the gym at that time.
Yeah.
But just transitioning to the rehab program and just work with the kin in there and maybe get some more advice and some more one-on-one work with him. I was really happy about that. I was happy for you, just because I knew that that's what you needed at the time. So that was, for me, that was huge. I was like, okay, I think he's ready.
Yeah.
So let's do that next step. And then, the next step after that.
And that was actually a really good little transition. I mean, obviously I didn't go back to the job that I got injured at. I mean, that was a physical job, and
Yeah.
I still have mobility issues. I mean, they did classify it as a permanent partial disability.
Right.
So it's something that I'm probably gonna have to deal with for the rest of my life to some degree or another. And being in the gym and trying to strengthen the muscles around the joint has been helping tremendously. And the work that I am doing now, it's just a sales job, but it's more standing and walking around, and even little things like that I have found to be very helpful. I mean,
Yeah.
that starting work again was a bit of a transition, and
Oh yeah, for sure.
I was very sore
Yeah.
at the beginning of that, and
Yeah.
there are still days where if I push it too far, I'm definitely going to feel it the next day.
Mhm.
First thing in the morning in general is always the most painful part of my day, because everything kind of seizes up and stiffens. So, the first steps of my day are
Yeah.
pretty well in pain, and it's unavoidable.
Yeah.
The limp is pretty severe in the morning, but give it 5-10 minutes and let things kind of wake up, and then it's not bad.
Okay.
I'm able to now use the stairs a lot better. I've actually started doing full steps down the stairs now, which is
Okay. Awesome.
pretty big progress.
That's huge.
I'm not baby stepping anymore. I'm doing full steps up the stairs, and sometimes I still do because it's it became a habit. And there's always that like little bit of hesitation that's kind of in the back of the mind
Yeah.
of like, hey, is this going to hurt walking down the stairs? And then you just do it. But
Yeah.
yeah, it's been a long journey. It's been over 2 years now.
I know, that's crazy. Crazy to think that. June 28th, right? 2023?
Yeah, June
Was your
28th.
initial injury? Yeah.
Go into work for a job that I was at for a week.
Yeah.
Which is also another crazy part in my opinion. And it was very life-changing. It's one of those things that nobody thinks is going to happen until it happens. Which is why it's always best to prepare, whether it's doing strength training or some fitness, and just
Preventative medicine, right?
preventative, right?
That's huge. Yeah.
Because I definitely didn't wake up that day anticipating that I was going to end up in the hospital and go into a 20-month recovery. But it happened.
Yeah.
And I think every single person probably that you've worked with over the years was probably in the same boat. If you had a brand new patient walking into your office with a severe injury, potentially a life-altering injury, what is the first thing that you would have that patient focus on?
So depending on the injury, I would just actually have just to spend some time reassuring them, depending on the injury, the time that it takes to get better, to be patient, just to try and focus on the rehab, because sometimes it's like a full-time job, right? Like you would know for
Yeah.
their rehab, and to try and dial in and focus on that. Um, is huge, I think. And then following just the proper steps to recovery, whether it be range of motion first, pain management. A lot of times, the doctors, pharmacists have to be involved for that as well,
Yeah.
because that's huge. If people's pain spirals out of control, it can be a very bad situation,
Yeah.
and that definitely impacts the recovery. And a lot of people I see too, they say, well, I don't want to take medication. I hate taking that stuff. And it's like, you know what? Sometimes you have to.
Yeah.
Unfortunately, none of us like to take anything, but that can be a big part of that initial
Yeah.
recovery. Keep the pain managed so that you can do the proper rehab and you are able to tolerate it.
Yeah, I was definitely in that boat myself. I mean, two surgeries, and obviously they gave me pain medication,
Mm-hmm.
whatever it was, some opiate,
Mm-hmm.
and I had that concern in the back of my head. I'm like, okay, well, I'm already dealing with this very serious injury. I mean, I
Mm-hmm.
don't want to have an opiate addiction on top of everything else, and I know that's something that a lot of people struggle with in that
Yeah.
kind of situation.
Mm-hmm.
Is they get too reliant on the pain medication, and then suddenly they have a new problem that they're dealing with.
Mm-hmm.
So for myself, I would kind of recognize and I would wean myself off, as appropriately as I could.
Mm-hmm.
And, before 4 weeks after surgery, I completely cut myself off. And nowadays I barely even take Tylenol.
Mm-hmm.
I mean, I get sore, it's just a part of life.
Yeah.
But it's not so much that I feel I need to be popping pills, every single day.
Mm-hmm. Yeah, which is good. And the other thing as well is, I think, is just talking to the patient about their diagnosis.
Yeah.
Because when they come to see me, sometimes they don't have an idea about a proper diagnosis, that they're just like, well, my doctor sent me here.
Yeah.
So I think, talking about the proper diagnosis, explaining it, and then the steps to the rehab, and then trying to have them just be consistent, I think is the most important thing.
So how do you think people can, what do you think the best way that people can do to balance, doing the work that they need to, but also overdoing the work? Like, is there a
Mm-hmm.
line there, a threshold that they should kind of keep within?
Mm-hmm.
What are your thoughts on that?
Okay, yeah, there's always a fine line depending on the injury, because if they push too much, and then, they may not realize it at the time, but then they stop sleeping at night, right? They
Right.
start waking up with pain, or they just can't function or can't do their exercises properly. So if that starts to happen, then we just kind of do a recheck. It's like, okay, let's maybe back off, do more of this exercise, less of this one. You need to ice more,
Yeah.
you need the conservative pain management techniques as well. Yeah, because there's definitely a fine line with most injuries that we see. And it depends on the person's personality as
Mhm.
well, right? Like some people just want to push through the pain and get better as fast as they can, and other people are afraid of any kind of discomfort.
Right.
So it also depends. Yeah, and once you get to know the patient a little bit, then you can kind of try to figure that out and how to help them in that way.
Right. Would you say there's a certain line that if you go too far past it, you're actually having a negative impact
It can
on your
happen.
recovery?
Yeah, it can. Yeah, that can definitely happen. And a lot of people will also just start doing their own exercises. Like
Right.
they're like, oh yeah, I just started doing this or doing that. And I'm like, no, don't do that.
Yeah.
Just do what I've
Yeah,
given
we'll
you.
get there.
Just stick to the plan. Yeah, we'll get there. But then that happens actually quite often. And then I'm like, okay, well, that's why you're more sore. Or that's why you're waking up aching at night, or you can't
Yeah.
sleep on that side now. So then it's just, doing a bit of a reassessment and then rechecking in with the patient.
I'll admit I was probably a little bit guilty of that on occasion.
Yeah.
Especially getting back into the gym, having the background as a strongman athlete.
Mm-hmm.
I loved it to deadlift, and I would
Mm-hmm.
go in and I would start deadlifting. Eventually,
Mm-hmm.
I started doing seated deadlifts, so
Yeah,
like an
I
adapted
remember. Yeah.
lift.
Yeah.
And, I would get very heavy on those. I was up to like 560 pounds and I was doing that for reps as a seated deadlift.
Right.
But then it's like, okay, well, I really like doing the standing.
Mm-hmm.
And I would start doing that. And I think the most I pulled was 495 pounds for a single rep. And
Okay.
just before I did it, I said, I'm either about to do something really awesome or really stupid.
Either one.
And it turned out it was really awesome because I did it. But
Yeah.
I haven't gone that heavy on them since. I think it was just more of a I need to see if I still can.
Yeah.
And, and I imagine you probably see that a lot in your patients. They knew
Mm-hmm.
their limitations that they had before the injury, and I
Mm-hmm.
imagine a part of their mind still wants to believe that they can still
They're
do
still
that.
there. Yeah.
And I imagine a lot can get back to that,
Mm-hmm.
but there's probably a percentage of, you know,
Mm-hmm. People
mm,
that never will.
yeah.
Yeah, that's true.
So do you have any tips or advice on, dealing with the mental health frustrations that do come with a long recovery?
I think the best thing is to get to see a good counselor, and then use your support system at home as well. Don't be afraid to talk about it, because so many people are afraid to talk about it, right? They feel like they should just be able to deal with their injuries on their own,
Hmm.
and because they've always been strong, maybe, or had a strong personality, and they've always got through things on their own before. But for some people, they can't do that,
Yeah.
right? And they shouldn't do that, because it's just, yeah, anything that can help with any kind of mental health issue is a huge part of the recovery. So usually I refer a lot of people for counseling, and I haven't had anybody say that, oh yeah, I shouldn't have done that. Like, they're all, yeah, happy to get the help for sure.
Yeah.
Yeah.
Yeah, that's for me, that was something that did help a lot. I probably could have used some more during certain phases of my recovery, but
Yeah.
just simply having somebody to talk to,
Yeah.
it does make a big difference.
Yeah.
And it was tremendously helpful for me.
Yeah, that's good.
And what kind of roles do you believe that nutrition and sleep and all of that related stuff? How do you believe that plays a role into the overall recovery?
So it's huge for sure. Yeah. I mean, I'm not an expert in those things at all, but just with general knowledge that, we all read, right? Especially if we exercise a lot, and proper recovery, and proper nutrition as far as enough protein, or taking adaptogens, right? Any kind of supplements that will help. I do always encourage people to talk to either a nutritionist,
Hmm.
or even seeing a dietitian. I've had some patients do, if they're diabetic, especially. They can get help with that. They can see the diabetic nurse, and that can help if they've had an injury and they're also battling some blood sugar
Yep.
issues. So that can be huge. And then as far as the sleep goes, yeah, I mean, it's huge for recovery for sure. People's pain levels always go up if they're not sleeping properly, if they're not getting enough REM sleep. Then they don't have the energy to exercise. And honestly, when we're all tired, we're more prone to injury
Yeah.
sometimes too, just with these repetitive stress injuries, or, unfortunately, people, they're exhausted, so they trip more, or they lose their balance more, and that's tough.
Yep.
And honestly, especially as people get older, right, our sleep patterns change just from hormonal changes.
Yeah.
Again, I'm not an expert on that at all, but I always encourage people to talk to someone, even just talk to the pharmacist, and say, okay, I'd like to, maybe, start trying a natural supplement before I talk to the doctor about maybe taking something, a prescription. And a lot of times the pharmacist can help, or they may end up just going to see their doctor and getting some advice on that for sure,
Right.
because they're definitely more the experts. Yeah.
Awesome. So, yeah, I think that's been a great conversation to have with you so
Okay, good.
far. Um, before we finish things off, I'll give you the floor. If there's any last things that you would like to say, pieces of advice,
Okay.
or just anything like that,
Okay.
while we're still here.
Okay, Darcy. Yeah, I mean, I think the biggest thing with any kind of injury is just don't leave it. I hear that all the time. Oh, I just thought it would get better. And then people are in to see me 6 weeks later or 3 months later, and then it's more chronic, and it takes longer to get better. So come in, get some advice, and get a proper diagnosis. And the earlier the treatment, the better. And something else too, like if I feel like, okay, this isn't my wheelhouse, this isn't something that I can help, then I will refer maybe to somebody else, whether it's a physio or another health profession.
Mhm.
Yeah, a lot of times we'll do that too, because sometimes it does take a village for these recoveries, for recoveries for people to get better and get their
Absolutely.
life back.
Absolutely, it does.
Yeah.
Well, Cynthia, I want to thank you so much for
Oh,
taking the
you're
time
very
out of your
welcome.
day.
Yeah.
It was an absolute pleasure to talk to you
Yeah,
and
thanks,
great to
Darcy.
catch up with you again. I know it's been a little bit
Yeah.
of time since we've seen each other.
Yeah.
Thanks to you, I did a lot of great progress in my recovery and, helped carry me forward
Yeah.
and, allowed me to be here today.
Yeah. That's
So
right.
thank you again very much.
Oh, you're very
And
welcome.
yeah,
Yeah. Thanks for having me. It was
awesome.
great.